I'm Dr. Lee Gregory. We're here with Teresa and Luna using the butterfly to begin our limited ultrasound exam of the abdomen. Luna is already in right lateral recumbency, pretty typical position for limited abdominal ultrasound. And we're going to be using limited abdominal ultrasound really for the patient that comes in that is either a triage situation or has an abdominal process, an unknown abdominal process, and we're trying to figure out what's going on. Home base for me is going to be the liver. The liver can be imaged either from a sort of subxiphoid position or can be imaged through an intercostal position. In right lateral recumbency in a dog like Luna, where her rib cage actually comes back quite caudal, we're going to go for an intercostal approach to try to get a kind of a global, quick shot view of the liver to start our scan. So I'm going to place the probe in sort of an intercostal position. And what I'm trying to do is get the liver sort of centered in my view. And I'm trying to see sort of the entire extremity of the liver. And I use the diaphragm as my marker to make sure that I really am truly capturing the entire extremity of the liver. So the diaphragm in this image is this white line that we see towards the bottom and left portion of the screen. And that diaphragm is actually demarcating, my abdominal cavity to the right from my thoracic cavity to the left. And here I'm simply looking for sort of presence or absence of abnormalities. So, for instance, is there fluid separating the liver lobes? Normally, I wouldn't be able to see demarcation between the liver lobes. If I was able to actually see the liver lobes defined, that's probably going to be due to some free fluid in the abdomen, whether that's ascites or some type of effusion. The other thing that I could evaluate from this view, I can be looking for any evidence of pleural effusion, which I might capture. And sometimes you can actually start to see some portion of the heart as well, and can be looking for things like pericardial effusion, hypovolemia, or microcardia. The other thing that I could be looking at from this view is the gallbladder. The gallbladder is a very characteristic organ. There it is there. And in emergency situations or at triage or for an animal that is ill, primarily what I'm looking at in the gallbladder is any sign of gallbladder wall edema that might indicate anaphylaxis or some type of vascular process that's happening that's causing some edema anywhere in the body. And so that's how we would start our limited abdominal ultrasound scan. And thank you to Luna and to Teresa.